welcome to Gender Agenda again. It's good to do this with you. How are you? How have you been? I know people have continued to call our phones and tell us how much they enjoyed the last series on the less privileged and the disabled young women and men, all the way through the journey when we traveled down to Southeast and Anambra State to the home and Les Meridias home created by Reverend Dr. John Bosco. However, this week we're going to be looking at something entirely different. In the world of women, you cannot remove the idea that children are part and parcel of the development and, of course, the well-being of their mothers. Now, if you think about women and motherhood, for instance, especially, you would also want to look at childbearing and look at, development of the child and the growth of the child. Most times, oftentimes than not, you would want to consider that the growth of a child depends mainly on nutrition, right? No. Now, surprisingly so, we have discovered that sleep is one of the most important factors in a child's mental development. So today we're going to go into the world of children, sleep, and even play to see how that altogether synergizes the most important components for child's development. And today with me on the show, I will be talking to a woman who understands the theory both in practice and in the literary term of sleep, play, and maybe, yes, the whole concept of development for a child when he looks at all of these intricacies. Her name is Dr. Ronke Akinla, and she will be coming up on the show shortly after this break. Stay with us. This is Gender Agenda. Now, you're welcome back. Now, Dr. Ronke, I know it's kind of quite asking you, how was your growing up?
My growing up, thank you, Adele.
You're
Good to
welcome.
be on the program with you.
Yeah.
My growing up was normal,
Okay.
what you consider normal.
Okay.
But then, how far back? As a baby, obviously,
Yes.
I can't remember what happened as a baby, but I
Okay.
remember having a very playful childhood.
Interactive.
Very interactive
Okay.
with my family, as well as with my peers, particularly with my peers.
Okay.
So I
Okay.
enjoyed the play bits, the play part of growing up.
Okay, but did you wear Pampers or you wore napkins? Be honest with me. Or you wore nothing,
No, I didn't come in my birthday, so I didn't stay that way. I'm sure I must have worn napkins.
You wore napkins there with all the
diapers,
pinks. That
no.
thing used to scare me a lot. But let's not focus on that. Now, we're talking about, sleep and play, nutrition and all of that. But let's start with sleep. Now, how important is sleep to a baby's mental development, especially as the child is growing up?
Good. It's good that we talk about growth. It's also good that we talk about development, and it's good that we try to differentiate the two.
Okay.
When we talk about growth, we're talking about an increase in size, and obviously good nutrition plays a very large role. But today we're not really talking about the role of nutrition. We're focusing more on the developmental part.
Okay.
Now, a baby needs sleep. A baby needs sleep so that he can recoup his spent energy,
Okay.
and that helps brain development.
Okay. This is Gender Agenda.
Sleep is important for a baby because it helps the baby to recoup lost energy. Sleep is also important because during sleep, growth does take place. In fact, there's a hormone called growth hormone that is released all through the day, and that hormone helps in growth of babies and children. But the growth hormone is particularly released more during sleep. So for those reasons, sleep is very important to a baby. How much sleep does a baby need? It varies from baby to baby, but generally the sleep requirements decrease as the babies get older. To help a baby to sleep well, there are a number of things that can be done, one of which is interaction with the baby during the day. Interaction in terms of talking to the baby, telling the baby stories, and then singing to the baby, helping the baby to develop a sense of rhythm. And when the baby gets about 6-7 months, begin to show the baby picture books for starters. All this help the baby to be able to interact, also help the baby to develop social skills, increases the cognitive function of the baby. And by the time the baby does that all day, by nighttime, the baby is naturally tired and wants to sleep. For a baby to have a good night's sleep, then it's important to keep the baby comfortable, change the diaper, give the baby a last feed, and then make the baby clean and as comfortably dressed as you would want to be dressed up, considering the weather. Play is, we can simply define play as a process through which a baby learns through all the 5 senses. So when play is engaged, the baby's 5 senses are also engaged, and play helps stimulate these 5 senses. In other words, play helps development. Play also helps the baby to develop physically. It helps motor skills, it helps social skills, it helps interactive skills. So play is involved in all areas of development. Those are the reasons why play is important. You can ask that, what kind of play comes in for a baby? By the time you are singing to a baby, that's playing. And by the time you're, making faces and the baby is watching, and in time also gets to imitate, that's also part of play, as well as stimulating the baby's senses. Babies can also be shown toys, but we must mind that the toys are safe, and babies should play with toys under close supervision. Toys are colorful, so all those help to stimulate the baby's senses. Now, a few years ago, the American Association of Pediatrics discovered that babies were being delayed, their development was being delayed. They also discovered that they were beginning to have abnormal shapes of head, flat skulls, and they investigated and found that the reason was because in order to avoid sudden infant death syndrome, they were encouraging babies to sleep on their sides and more on their backs. And unfortunately, the unwanted side effect was that babies were getting later in their development, there was delayed development, and also the abnormal shape of head. So as a result of that, they were encouraged to have more tummy time. Tummy time simply means putting the baby on the tummy for a few hours in a day per time. So, but it's important that when these babies have tummy time, it must be done under supervision. Tummy time helps a baby to develop the physically, motor skills as well. Babies can stretch, move their necks, move their backs, and inadvertently do push-ups as they grow on. And so yes, that's the importance of tummy time. Also, when babies are on their tummies, you can show them picture books, help them to play with toys, interact with them, stimulate them, so that by the time they play and develop, by nighttime they are spent, all they want to do is to go to sleep.
This is Gender Agenda. Now, when you talk about development, you're looking at the mental aspect of development, or are you also looking at the fact that does sleep also affect the increase in size?
Development is all encompassing.
Okay.
If you talk about development, you're talking about physical development, and you're looking at the motor skills.
Okay.
You're looking at gross motor skills, that's running, jumping, crawling, those are gross. You're also looking at the fine motor skills, picking up a pencil.
Wow.
Yeah.
That's part of growth?
Yes, part of development.
Okay.
Really. And then you're looking at the social interaction. You're looking also at the cognitive functions.
Okay.
And the baby begins to look away from just me and mommy and food.
Okay.
The baby is interested in the environment, what's going on in the environment.
Okay.
So those are integral parts
Okay.
of development.
Okay, now, how well, mothers are different in the way they handle their children.
Certainly.
So when you're looking at what mothers need to do to make sure their babies have, a good sleep or a restful night, what are the important aspects of that?
Let's start by talking about sleep requirements.
Okay.
Sleep sleep requirements vary from baby to baby, and also alters a little bit as the baby grows. For instance, in the first month of life, the baby needs a bit more sleep, 16 to 18 hours on the average. But all of the sleep doesn't have to come in one block, but as the baby grows beyond 2 months to 6 months, the sleep needs decrease to 14 to 16 hours averagely.
This is Gender Agenda. When you define democracy, it's procedural. But when it is right, it is when a lot of them are saying that the women can help, but when they get there, all they do is think about themselves.
Societies do not like women.
The political parties will not give women space. Women have to take it.
The party structures from the ward level should include women. It shouldn't just be only woman leader.
It is time that we know that gender agenda is about women who needs to arise. What I want to understand is, now you've spoken about the baby themselves. Now the mothers are different.
Okay, how do mothers come in? Okay, mothers need to understand that babies differ. Okay, so what works for one baby may not necessarily work for another baby 100%. And babies, when they just come in, their mother and baby are almost strangers. Mother is trying to understand baby.
Even after 9 months inside the body?
Oh, of course, that was a different relationship kind of. Okay. This one is more like a physical. Now I know it's you. You are the one.
Individually.
Exactly. Okay. So, baby is trying to understand the mom. Mom is also trying to understand the baby. So I would caution that mothers should be patient with their babies and then study them. It's also important to know that when babies are in the womb, they don't recognize a daytime pattern
or a nighttime pattern. But they sleep, I understand. They sleep in the womb.
They do. But, as baby begins to grow, you want the baby. Many mothers want to sleep well at night. So they want the baby to sleep all through the night. But that may not
necessarily work, yes.
Particularly in the first month or two, because the baby's brain is developing. And for a baby to be able to concentrate sleep, that is sleep 6, 7, 8 hours at a stretch, it's a show that neuronal development is going on. You don't expect that at 2 weeks of life. What you see at 2 weeks of life is different from what happens at 6 months. So we have to be patient. But having said that, babies learn. They learn to concentrate sleep through how mothers, particularly, and parents generally interact with them. So a baby who's had a lot of stimulation during the day, mother is playing and talking with the baby. Yes, we can talk with our babies, telling the baby stories, engaging the baby in play, face-to-face interactions, showing the baby maybe picture books, at a certain age, and generally engaging the baby. That kind of baby has spent a lot of energy during the day. So by nighttime, the baby is tired.
Wearing down.
He wants to sleep. So, that helps sleep.
Okay.
The other thing is a baby who is uncomfortable, a baby who is wet, a baby whose diaper is wet, may not sleep so well and cry. The baby's trying to tell you, hey, mom, I'm not comfortable, I want this wet diaper taking off. And that's where Pampers comes in, to help keep the baby dry. So it's important that the baby is dry. A baby who is comfortably clothed as well will likely sleep better than a baby who is not. It's also important to recognize that an ill baby
will sleep well.
Will not sleep well. So we as mothers need to be very observant.
Okay, but then how do you tell, what's the number of hours cumulatively that a child or baby is meant to sleep? And how do you tell that a baby has had a wonderful, wonderful time sleeping?
It's good to have a rough guide. Like I said initially, 16 to 18 hours first month, which begins to decline over time. But if you're going to look at a baby's disposition and say, which baby has slept well and which one hasn't, a baby who has had sufficient sleep, a baby whose sleep requirement has been met, it's likely to be a happy baby, you know, a baby with a very good predisposition. As you
Okay.
know, when babies haven't slept well, they become cranky. So
Do they get bags under their eyes as well?
not characteristically,
Okay.
not like you or I.
Yes,
but
yes.
that baby is likely to be cranky
Okay.
and cry all the time. So that's one good way of differentiating a baby who slept well.
And
one
what,
who
what
has-
about diaper rash? You know, you talked about illness. I know that diaper rash may not like necessarily be defined as an ill, but it's a symptom for some diseases.
It's a sort of
Yeah.
discomfort,
Yes.
yes. And any rash that is associated with diaper area may not, you know, or change in skin, consistency, color is regarded as a diaper rash. It's important to recognize that there are various causes of this diaper rash. But in the first year of life, the commonest cause is really what we call ammoniacal, you know, and that is caused by the interaction of moisture and chemical components with the baby's skin. And that can be prevented, and in the event that it does occur, it can be easily, you know, taken care of. So the key factor there is keep the diaper area
Okay.
as dry as possible, and that's the message that Pampers is passing
Okay.
across.
Now, talking about, before we get to the issue of, you know, okay, let's just deal with that now. I mean, I do remember that it was last year, at least, I think 12,000 cot deaths, you know, in America alone. I don't know how Nigeria is faring because we don't, you know, naturally use,
statistics,
yeah,
yeah.
statistics, use cots as much as we other African countries or, yeah,
countries,
developing
yeah.
countries. Now, co-sleeping with a baby, you know, has always raised issues for certain families. How ideal is that, you know, in your experience?
Co-sleeping with the baby, in other words, does it really have a place or not? You know, we canvass for exclusive breastfeeding because of all the benefits that
Oh, okay.
exclusive
Yeah.
breastfeeding offers in the first 6 months of life. And it's easier for a mom to breastfeed her baby when she's sleeping in the same room with her baby,
Okay.
and particularly when she's sleeping on the same bed with her baby. So yes, that does have a role to play,
For the first 6 months.
particularly in the first 6
Okay.
months. Having said that, however, a lot of caution needs to be exercised so that mothers don't suffocate the babies, even
Or
when
roll
they're
over
sleeping,
them.
or roll over the babies, and you know, let the babies go that way. So mothers have to be very careful, very watchful, and even while, you know, they're sleeping. So.
But if you look at maybe the pattern of sleeping for certain mothers, you know, some actually sleep and forget, even those who are breastfeeding, except when the child cries, and forget. And also understanding that baby's role, you know, while sleeping, is it also ideal? Because I have seen quite some people's experiential stories saying the baby's rolled off the bed, or, you know, rolled to a point of the bed where they didn't feel the child and kicked the child off the
Yeah.
bed, you know. So is it really ideal? Because that's when the child is most tender, you know, for some people. Or should this be based on, you know, personal choice?
Again, I think we need to go on a case-by-case basis. We need to look at factor in all the
Okay.
circumstances. Having said what is ideal, but if a mom is, in quotes, not as careful as
Okay.
another mom, then that may not be ideal. But generally, having babies sleep on flat surfaces all the way, no raised edges, can be dangerous because it can easily fall over.
Yeah.
But even when they sleep in cots, it's important that babies...
Attentions are paid to.
Yeah, supervision,
Yeah.
and they should lie on their backs or on their sides to avoid what you brought up, you know, the sudden infant death syndrome
Yes,
that
yes.
was commonly caused by suffocation.
Okay.
So it's important to remember to let babies lie on their back, on their sides, rather than on their tummies.
Do babies have insomnia, Dr. Rogi? Because I've heard issues of, oh, my child I feel this child has insomnia. This baby, there's something wrong with this baby, you know.
Well, if mothers feel the babies are not sleeping enough,
Okay.
then they could say, there's a problem. But what the complaints I hear often is this baby doesn't sleep all through the night. And I say, you know, it's a new baby. The baby is just developing the brain connections. The baby will not sleep all through the night.
Okay.
The baby needs to feed. So the baby
Yes.
wakes up. But as baby gets older, and then as we put in those factors that we talked about earlier, then we help the baby to concentrate sleep, particularly.
This is Gender Agenda. Talking about infection, how hygienic and safe is it to use Pampers baby wipes? I mean, you see a lot of baby wipes around, and you find the ones that say, oh, aloe vera, the ones that say non-water. I mean, is that hygienic even for a child to use baby wipes?
Yes, but water is good, and it's the most natural thing to clean baby, and that cleans baby very effectively. But we do not have access to water all the time.
Mothers are always mobile these days. You know that. There are too many career women docking their babies at the back of their car. So
certainly wipes. But whatever it is that we do, then we must clean the baby thoroughly, either with water when it is available, or with wipes when it is.
Okay, finally, let's talk about the mom here. We've said so much about the baby's development and sleep. Now, what about sleep for the mother? Because like a woman who hasn't slept a lot would also be cranky. Does the sleep cycle of a mother also affect her interaction and playtime with the baby? What is recommended? Yeah.
A mom who's not slept well, like the baby, is also cranky. And because she's cranky, she's not in the best psychological state to look after that baby. So as much as possible, the mom should try to rest well. Now, what we advocate, because new moms particularly are busy, so what we advocate is do all that you have to do, but when your baby is sleeping, also find time to rest at that time, so that when the baby wakes up energized, ready to go, you also have rested. Mom is energized, ready to go as well.
Okay, thank you so much, Dr. Okay,
Thank you,
I mean, it's interesting. I'm sure you have some children of your own.
I do.
And now I can understand that. Well, you've been talking to Dr. Ronke, and I'm sure you've learned a thing or two. For me, I rather would not have considered that, sleep, per se, might necessarily be important for development for a child, but it is most important as much as you look at the nutrition for the growth and all other factors, even skincare and the kind of diapers you use. And, Pampers is here also telling us that the numbers of times that you put a child in diapers is also considerably supposed to vary, especially as you need air and also supposed to allow the child's body to ventilate. This is what we'd rather cotton, but remember, stay dry. Yeah. Can I say that? Use Pampers. My name is Adora Yeter. See you again next week. It was nice doing this with you. And yes, this has been Gender Agenda. Over. Bye.
Signature Hills Limited, in collaboration with The Wrong Concept, presents Learn to Earn, a 2-day skill acquisition forum with a network of job opportunities. Exclusive offers. Basic food production training includes baking and catering, events management, videography and presentation, includes visual and screen, presentation by world-class media practitioners, self-development and leadership class, fashion design and tailoring. Date
November 27th and 28th,
2015. Venue Merit Hall, Maitama, Abuja. Time 9 a.m. Registration form 2,000 naira only. Available at AIT, Drum 6, Hot FM and Ray Power. Training fee 15,000 naira only. Payable to any UBA branch to Signature Hills Limited. Account number 101-734-1605. Bring teller to training center for confirmation. For more inquiries, contact 080-2222-6437, 070-615-89858. Limited places available.